Hello, everyone. Thank you so much for joining me today for another episode of Diverse Thinking, Different Learning. Today, we are continuing our conversation about treatments for anxiety and issues with mood, with a focus today on cognitive behavioral therapy, which has been shown to be an effective treatment for children and adolescents with anxiety, issues with mood, and a review of a number of studies found substantial support for CBT as an effective first-line treatment for children. Another research study showed that up to 60% of young people treated with CBT for anxiety disorders and depression experience a significant decrease in symptoms following treatment, and that reduction in symptoms is likely to continue at least 4 years post-treatment. So I am excited to talk to you all today about cognitive behavioral therapy with my guest, Dr. Shadab Jannati. Dr. Jannati is a licensed clinical psychologist with a private practice in Los Angeles. She has over 20 years of experience working with children with a variety of social, emotional, and behavioral challenges. She has over 20 years of experience working with children with a variety of social, emotional, and behavioral challenges. And she is here today to talk about cognitive behavioral strategies, play therapy, and how she even incorporates mindfulness practice to assist children in managing and coping with their emotional struggles.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hi, Dr. Jannati. Thank you so much for being here.
Hi, Dr. Wilson. Thank you so much for having me. I'm so excited to be here.
I'm excited too. And I'm excited. Our listeners don't know this, but we worked together years ago. And over the last year, we reconnected. And I was so thrilled because so many families need you, your work, and your expertise. And I'm so glad to have you here as a guest.
Thank you so much for having me.
You know, last week we talked about parent-child interaction therapy, and I was eager to have you on to talk about a different technique that is used with kids who struggle with anxiety, depression, self-concept issues. And so I was really excited that you agreed to come on the podcast to talk about cognitive behavioral therapy, which is another therapeutic approach.
Yes. So cognitive behavior therapy, I will say CBT for short from here on out. It is a form of psychotherapy that was established by Aaron Beck in the 1960s. It has evolved over the years. The second wave type of treatment is more what I'm going to be discussing today. And there's also third wave types of treatments, which include dialectical behavior therapy, acceptance and commitment therapy, and mindfulness-based cognitive behavior therapy. So it is an evidence-based practice, which is really important because there's so much research that says that it's effective and that it works, and especially for anxiety and depression. It's usually short-term, and it's solution-focused, and it's more about the here and now and what's going on in the present moment, and not so much about the past as much. It's goal-oriented. And it's not just like a traditional type of talk therapy. We pick specific goals for each, client that would come see me. Let's say, for example, if there's a child with social anxiety that comes to see me, then we would pick specific goals about starting social interactions or saying hello to maybe 3 people a day, and then gradually to moving on to making a new friend. Or if there's a teenager who's depressed and is having trouble sleeping, then we would want to work on improving their sleep habits and trying to get a full 8 hours of sleep a night. Or a child who exhibits angry outbursts, the goal would be to help them identify and talk about their negative feelings instead of acting them out. So whatever the biggest struggles are, we would be, choosing skills and areas to improve through specific and measurable goals.
Right. And it sounds like parents come to you with various concerns because you described a few: anger management, sleep disturbance, self-concept, like we talked about, anxiety. And so it sounds like kids might come to you, but they may not actually have a formal diagnosis of depression or anxiety, but could still benefit from cognitive behavioral therapy.
Absolutely. Yes. I mean, usually they fall under the umbrella of some type of anxiety or depressive, disorder. But sometimes they might not meet all the criteria. And we just want to really work on whatever is impeding functioning at home, school, whatever in their daily lives is being impacted. So we could do that. And that would maybe be a little bit more of a short-term type of treatment. For those who have, the actual diagnosis, then it might be something more long-term.
Right. And so CBT is a type of talk therapy, but it sounds like it's it's goal oriented.
Yes. It's goal oriented. So the cognitive model of CBT is based on thoughts, feelings, and behaviors. And basically, it states that in every situation, there will be certain automatic thoughts that will lead to certain feelings and behaviors. So it's not necessarily the actual event that causes distress, but how that individual interprets the event. Because there's, a single event can trigger completely different responses in different individuals because they interpreted that event differently. So for example, if you have a teacher who just announced that there's a math test that's coming up, that's the situation. You might have a student who might think to themselves, I'm so bad at math, I'm going to fail this test. And they might feel anxious, and their behavior might be that they're not going to study because they already know what the outcome is going to be, which is probably a bad grade. But on the other hand, you might have another child in the classroom who just thinks to themselves, oh, this is just another test, I'll do fine if I study. They might feel calm about it, and their behavior might be that they'll study as usual. Or you might have a teenager who didn't get asked to the prom. And, she might think to herself, no one likes me, I'm never going to get to go to, events like this. She might feel sad or hurt. And her behavior might be that she cries and then withdraws for a few days from her family or friends. But then you might have someone else who thinks to themselves, oh, well, I'll go to the next one. And their feeling might be that they're probably fine, or they're maybe hopeful that they're going to get to go to another dance at some point soon. And their behavior, basically, life goes on as usual. So everybody, it depends on the person, how they interpret these situations and triggers and events. So with CBT, we really want to look at specifically what are the thoughts, feelings, and behaviors that particular person is feeling, and how can we help them make the connections between those three parts? Another important aspect of that is the body sensations. What is their body telling them when they're having these thoughts or feelings? And, trying to pay attention to the body cues, because once you are familiar with what your body cues tell you, then you're able to kind of be more aware and identify what those thoughts and feelings would be to work on changing them. So being aware is a very important step to change and shift unhealthy patterns that arise over time.
Right. And it seems like you're doing a lot of teaching, because I can imagine a lot of kids have these body sensations, but haven't connected it to the anxiety. They may have the thoughts and have not made the connection that their thoughts are making them feel a certain way, and then as a result behave in a certain manner. And you're helping them make those connections.
Exactly. Right. We're trying to get them, we use different ways, talking or worksheets with, pictures of, let's say, a body. And we try to, identify where in the body would you be feeling, what might be anxiety. Is it in your stomach? Is it the, butterflies that you feel? Or do your hands feel tense? Or are your thighs tense? Do you clench your teeth? Do you, bite down hard? Like, there are all these things that people aren't even aware of, basically, that just really talking about it helps become aware. And so when those cues show up, then they know, okay, this is probably me feeling anxious. So now I'm going to work on thinking differently about the situation, or using a coping strategy, to help my body feel more calm and regulated, to be able to handle whatever situation is triggering in that moment.
Right. So the first step is really awareness of the thought and of the biological feeling.
Right.
And then it sounds like there's a restructuring that takes place when you're thinking about those thoughts, that you're taking that negative thought, nobody likes me, I'm a terrible student, and really flipping it to a different thought, a better thought, and maybe a more accurate thought.
Exactly. Yes. So what you're talking about are often with anxiety and depression, there's a tendency towards negative thinking. And somebody might have irrational or unrealistic thoughts about a situation, and that's what we call cognitive distortions. There's many different types. For example, there's catastrophic thinking where, you might assume the worst in situations. For example, my friend canceled plans, I'm not likable and I'll never go out again. Or if I don't do well on this exam, I'll never get into a college or be successful. Or there might be overgeneralization where they take, one example of a negative experience and apply it to all, and using words like always and never. I said the wrong word during my presentation, so I'll never give another speech again. Or I didn't make the basket during the game, so I'll never be a good basketball player. Or mind reading is another common one, especially with anxiety, where you're convinced that you know exactly what someone else is thinking. She canceled the plans because she didn't like the way I spoke with her, or my teacher didn't call on me when I raised my hand because she doesn't like me. So these are obviously irrational and unrealistic. So we work on first identifying these and then challenging the negative thoughts and replacing them with more realistic and positive ones. So, we would do something called like a thought record where you keep track of your daily thoughts, and then we would try to work on challenging them. So this is a negative thought that I'm having. What's another realistic, positive replacement to that thought? Oh, okay. So maybe she canceled the plans, but didn't she say in the text that, that we can reschedule? So looking for clues and cues that can challenge that distorted thought and help you see the other side. And because there's such a focus on the negative that, you really want to try to bring a magnifying lens to what are other possibilities and, what are the positive thoughts that could replace that.
And so it sounds like there are a number of different techniques that are involved in cognitive behavioral therapy. And one of the things that you mentioned was, again, those physiological experiences or symptoms that kids experience, the sweaty palms, the rapid heart rate, those butterflies that you described. How do you help them with addressing those?
So being aware of them obviously is the first step. And then, we come up with coping strategies, and very individualized ones, because not every coping strategy is going to work for every child. So I really try to get it to be, ones that they particularly take to. So maybe taking deep breaths may not work for one child, but it might for another, or going out and, going for a walk, or getting a drink of water, or doing a few stretches, or whatever it might be that would work for that child. So we definitely work on coping strategies. We work on mindfulness, which is definitely really important in helping with anxiety and depression. So when you feel those cues, the body sensations that we talked about, how can I stop in this moment and just, focus on accept that nervous feeling is there, acknowledge it, and, and say hello to it, and just say that it's there and just let it go. Just like waves come and go, feelings come and go. And, sitting and taking the deep breaths and, just these regulating kind of tasks that would help.
Right. And I love that mindfulness technique, because oftentimes when individuals have those negative thoughts, there's so much judgment attached to them. I shouldn't feel this way. I shouldn't be thinking this way. I shouldn't be behaving this way. And with mindfulness, it's really non-judgmental. You have the thought, you allow yourself to feel it, to think it, and then you just let it go.
Yeah, because sometimes just acknowledging its presence and naming the feeling that it's there is therapeutic, and you can it leaves faster rather than just, like you said, like being judgmental and just beating yourself up for it. And it just, that feeds more of the negativity, the negative thinking and like schema that is a part of anxiety and depression. So it just kind of perpetuates the cycle of that, over and over thinking, ruminating on negative. So this helps you focus on accepting it and being okay with it and moving on.
Right. So you focused a lot on the cognitive aspect of cognitive behavioral therapy, targeting those thoughts and obviously the behaviors that you are targeting. You're trying to reduce those anxious behaviors, but you also utilize play therapy into the work you do. Is that because of the little ones that you're working with?
Yes. So little ones do have a hard time just sitting and talking like you traditionally would in therapy. So we use, play-based strategies. So playing games. And there's actually different like cognitive behavior therapy games that we use. Or you can take something as simple as like a Jenga and, write questions, on there about like, tell me an example of a time you felt frustrated and how did you handle it? Or what do you do when your body feels this way? Just incorporating it more through fun, activities, or, sometimes themes of frustration and having difficulty losing or feeling anxious, not winning. These things come up in play so we can work on the coping strategies right there live in session. And, I also do like to use more projective type of play. So there's doll houses and things like that where, kids sometimes act out what's going on internally in their daily life. And so I work on commenting and processing those interactions and situations and, how can they solve their problems or how can they address that particular, issue that comes up more indirectly through the play-based.
Right. And again, it sounds like it's really individualized based on
Yes.
the child that comes into your office, the teen. Is there an age range where CBT is appropriate?
I mean, I think it's, appropriate basically any age, like, 4 or 5 years old, all the way through adulthood, obviously. But I think that it's very effective in the age range of the kids that I work with, which is 5 to 16 or so.
Mm-hmm.
Yeah.
And I imagine you can explain this to teens and they would really get it.
Yes.
And for little ones who are coming in to work with you, I imagine they think of it as just, I'm going to go play with Dr. Jannati.
Yeah, I mean, they do know that there is some hard work that needs to be done. And, there are worksheets and things like that we do. We role play. There's homework assignments, different things that we do. But yes, I mean, there's the fun aspect of it, but there's also, well, we're going to try to talk about some of the things that are uncomfortable. Because, with anxiety and depression, you tend to want to avoid facing the challenges and avoid the things that make you feel anxious. So, it is something that they know that we have to do a little bit of, but we can follow it with a fun activity or something reinforcing that feels, fun and exciting. But yes, definitely psychoeducation is a big part of even explaining to little kids about how the neuroscience of emotions works and how the amygdala, can be overly active and cause our rational thinking brain to not work as properly, and that we want to really calm this stress activation system so that we can use our thinking brain more. And Dr. Siegel has a wonderful example of how to do that with using a hand model of the brain and flipping our lid when we get, overactive and stimulated and stressed out, and how to bring that lid back down and, just kind of calm ourselves, which is through these coping strategies and, the mindfulness and helping parents like help their child, feel regulated by doing these activities with them.
Yeah. And I think that example is so wonderful because kids get a visual of flipping their lid and then calming themselves down.
Exactly.
And you mentioned psychoeducation. I think that's so important because I think that provides some normalizes the experience and has a name for it.
Exactly.
And then they can understand it better. They can understand the feeling. They can understand the emotion. They can understand the anger. And then they know that they're working toward addressing it in some way.
Right.
So there's a hopefulness associated with engaging in treatment as well.
Mm-hmm. And there's a sense of relief because they now have a name for what they've been going through and what's been going on in their body, all these stomach aches, and feeling like you want to throw up, or just having trouble sleeping, and all these different things. Like, they just, once they realize why it's happening, I think it gives that sense of relief to know now what we can do about it to improve.
Absolutely. I think relief is a great word because it's just like, oh, okay. There's not something wrong with me. This is just my brain is processing this information in a certain way. And I'm going to teach my brain to think about it differently so I can feel different about it.
Right.
Now, you're working with kids. Parents are such an important part of their child's treatment and their progress.
Absolutely.
Can you talk about how you incorporate parents into the work their kids are doing in therapy?
Yes, definitely. Kids come and see me for about a 45-minute session once a week. And who are they with the rest of the time? Their families. So, of course, including and involving the parents in the treatment plan, understanding what the goals are and what the strategies are is so important. Oftentimes, the parents will come in for part of the session. So usually beginning or the end, but the end is best because then the child can explain to the parent what they learned and what strategies they're going to try to work on and what the homework is, and how the parents can help make sure that those things are worked on. And so the parents are a very important part. And we do practice, either role playing in the sessions and, involving them in, let's say, mindfulness is one of the homework assignments. So as a family, how can they do it together so that they can, it's a family affair. So when parents can be involved in the sessions, that is ideal. But, there are times that parents cannot. And, I would schedule a session separately, either, over the phone or once a month, in person, and just go over the different interventions and strategies that we're working on so that they can, really help implement them at home so that the child will, make progress much faster if these strategies are being used across the board and not just in session with me.
Absolutely. It just feels like that would make the things that you're teaching them more generalizable if they're being reinforced and modeled by family members who've worked with you to help address their child's struggles. So that's wonderful to hear. I feel like parents want to be involved and feel like they're a part of the process in helping to alleviate some of the struggles and the feelings that their kids have.
Yeah. And one thing that's really helpful is a lot of these do run in families, a lot of these issues. So it's helpful for parents as well to be able to do the strategies that we talk about for themselves when they're feeling anxious or when they catch themselves kind of, thinking maybe more negatively about a situation and how to reframe it and restructure their own thoughts. So it's kind of, trickles down to everybody in the family.
That's a really great point because we know anxiety, depression, even ADHD run in families. So, the strategies you're teaching the child, the parents, again, would benefit from that learning as well to implement in their own lives.
Yeah.
One thing, we had Dr. Pia Santini from UCLA on the podcast a while back. And one of the things that he stuck out to me that he said is that, 80% of kids with problematic anxiety don't get treatment. And as I hear you describe CBT as an effective evidence-based treatment for children and adolescents with anxiety and issues with mood, it reinforces the fact that I want to get this information out because sometimes parents are seeing the stomach aches, hearing about the headaches, seeing the nervousness or the avoidance, and not really realizing that this is anxiety. And once they know, then they can connect with, practitioners like you who can really address the issue. And this is not a treatment that goes for years and years. When you think about CBT sessions.
That's right.
Yeah. Talk about the kind of the length of sessions. I know it's going to vary between kids and what they're presenting with, but this is not 10-year therapy.
Right.
CBT
exactly.
with kids.
Yeah. No, I mean, it is usually when you do traditional CBT, it is usually about 12 to 24 sessions is, what is described. But I think that does depend on the severity of the symptoms and the presentation and how much it impacts daily functioning in life. And also sometimes there's, other issues that, come into play that need, more intervention. So I think it just really does depend on the situation. But I think just learning whatever skills you can in a short period of time can make such a difference. And it doesn't have to be, like you said, long term. I would say on average 6 months to a year is probably the usual kind of time frame for therapy and making an impact.
Wonderful. Well, Dr. Jannati, you have provided our listeners with a great deal of information about cognitive behavioral therapy. One of the things I wanted to do was just to give information about different modes of therapy. We've talked about dialectic behavior therapy. We've talked about PCIT. And now to talk about cognitive behavioral therapy has been so helpful. And I know it's going to be so helpful to so many families who are listening and who have kiddos who are anxious, who feel bad about themselves, who engage in these negative thinking, and they want to reduce those feelings and those thoughts. And if parents have more questions, how can they reach you?
Well, they can reach me through my website, which is childrenthrive.net, or they can email me at drshadab@childrenthrive.net.
Perfect. And I will make sure that I put all your information in the show notes. Thank you so much for joining me today.
Thank you so much for having me again. It was lovely to see you.
Thank you so much for listening. It was a pleasure having you here joining us today for this great conversation. Make sure to check out the show notes. We've got some great resources regarding anxiety and depression in the show notes. And join us next week. We're actually going to talk about how we can incorporate some of these cognitive behavioral strategies in schools. Thanks again for listening, and I'll see you next time.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.